The U.S. has surpassed a grim milestone in its battle against the coronavirus. The total number of cases since the pandemic began has gone over 10 million. That's according to Johns Hopkins University. The U.S. not only has more cases than any other nation in the world, but the outbreak is also spreading faster than ever. It only took 10 days for the U.S. to add another million cases. COVID-19 has claimed more than 237,000 lives in the U.S. Well, while there's still progress to be made, HIV is much more manageable than it used to be. Now, a new two-drug approach could make life a little easier for those living with the disease. Holly Pilot reports.
Dr. Kimberly Smith is the head of research and development at Viv Healthcare. She says we've come a long way since HIV treatment first became available.
In the late 80s and early 90s, it was life-saving for a lot of people, but it was very complicated.
Patients then had to take 20-plus pills a day, several times a day.
To the point that they often needed to have alarms to remind them in the middle of the night to wake up to take their medicines.
Now people can manage HIV with one pill a day, but Dr. Smith says up until now, that one pill contained 3 to 4 different drugs.
The major progress that we're talking about today is that we now have a 2-drug regimen that is as effective.
The new pill is called Dovato, and Dr. Smith says since people may take it for decades or even the rest of their lives, the fewer drugs, the better.
You can reduce the number of side effects, and that'll allow people to more consistently take their medicines. And if they consistently take their medicines, they can live long lives.
Plus, she says if you can keep up with a manageable drug regimen and get your HIV level to undetectable, you won't transmit it to a sexual partner.
Give them the best options and allow them to focus on living their lives, not focus their lives around HIV treatment. And so we think this is major progress.
Dr. Smith says Dovato is for anyone with HIV who has never had treatment or those who do receive treatment and just want to reduce the number of drugs. According to a new study published today in the medical journal Pediatrics, 20% of parents in the U.S. are vaccine hesitant. Their children were found to be less likely to be vaccinated against the flu. The research was conducted by scientists at the CDC's National Center for Immunization and Respiratory Diseases. Vaccine hesitant parents were more likely to be concerned about long-term side effects of vaccines and more likely to have 3 or more children. Teens who start using e-cigarettes are 4 times more likely to start smoking conventional cigarettes a year later. That's according to a new study. That was true even if they never intended to start smoking. Researchers say the findings suggest e-cigarette use facilitates cigarette smoking primarily among tobacco-naive adolescents with no previous smoking intentions. They also say doctors can use the data to intervene before their young patients start vaping.